These are the exercises regarding manual lymphatic drainage. The first is deep breathing. Okay, you should do it 3 to 5 times. Okay, you should focus on feeling your abdomen coming out. Okay, the second exercise is in fat circles above your clavicle at the base of your neck. 8 to 12 times each side. Okay, you should know the exact weight of half of this exercise. Third exercise in fat circles above your this is also 5 to 10 on each side. You should know the exact way to do exercise, to perform on the patients, exactly what is the sequence, okay? You should need hands-on practice as well. Do practice these exercises.
Do manual lymphatic drainage of the lower extremity, and for the purpose of the video we will consider my left leg the affected lower extremity. Before I get into the sequencing of how to do manual lymphatic drainage of the leg, I need to talk a little bit about the stroke. The stroke is very light. It's about the weight of your hand, and you're just trying to move the skin. So it's really just a skin massage. You just gotta do your manual lymphatic drainage in the right direction. So you want to follow the sequence that I go through. The sequencing is important. So before you even get into the leg, you've got to do some trunk massage. So your manual lymphatic drainage will start right here in this fleshy area above the collarbone, the supraclavicular fossa. You're going to cross your arms in front of you, and you're going to massage in a circular motion in this area. Think of your fingers or your hand being glued to the skin, and you're moving your skin. You're not moving your hand across the skin creating friction, you're moving the skin. So for the purpose of the video, 10 reps is sufficient in each stroke. I won't do 10 reps today, but you will be asked to do 10 reps. So after you do 10 reps here in your supraclavicular fossa, you're going to go straight to your belly. You're going to be doing some deep resistive breathing of your belly. So what you're going to do is you're going to push lightly into your belly, right near your belly button. You're going to take a deep breath in through your nose while you give your belly a little bit of resistance. So it would look like this. Once you do that, you're going to exhale through your mouth and still exert a little bit of compression to the belly. So inhale, exhale. Inhale and exhale. 2 sets of 5 are sufficient. Once you are finished with your belly breathing or your diaphragmatic breathing, you're going to get right into the lymph nodes on the affected side, the axillary lymph nodes. So you're going to get right in there, 10 stationary circles, right into the axillary lymph nodes. So after 10 strokes, your hand placement slides down. So you're about at your brow line. You're going to massage back and up towards those axillary lymph nodes on the same side. So 10 stationary circles here. Hand placement slides down to your rib cage. 10 stationary circles at the rib cage with the direction of strokes back and up. Release on the upward stroke. Don't pull the skin back down. Your last hand placement is at your hip bone. Same stroke, which is back and up towards the axillary lymph nodes. 10 times. Once you're finished with that, you're going to go to the inguinal lymph nodes on the unaffected side. So you're going to massage 10 times, use all of your hand right in your inguinal area where your leg meets your torso. Once you do that, you're going to massage in your lower abdomen. You're going to start above your unaffected leg, but your direction of your strokes in your lower abdomen is actually away from your affected leg towards the unaffected side. Then you come to this side. Massage towards the unaffected leg. Once you've completed your trunk, now it's time to get into your affected leg. Your first hand position is at the top of your leg. The direction of strokes is back and up toward your buns. Over and up. 10 times. Now, which is over and up. Your last hand placement is above your kneecap. The direction is still the same, over and up. You should be able to see your skin wrinkling, over and up, 10 times. Once you finish that, you're going to come back to the top of your leg. Now you're just going to massage over to the outside of your leg, 10 times. Here, hand placement slides down to the mid portion of the inner thigh, over, now, over, over. Last hand placement above the kneecap. The direction of strokes is you're still pulling that out. Once you've completed that, now you're going to go back and you're going to massage up again, over and up, again towards your buns. I like to use both hands. You cover more surface area that way. Mid-thigh, over and up. Keep your shoulders nice and relaxed. Keep your hands relaxed. Last hand placement, over and up. So once you finish that, the knee area, what I like to do is massage back and up. Still a relaxation phase at the top of your stroke. You can even massage right over the top of your kneecap if that's the problem, over and up. 10 strokes. From there, bend your affected leg. The next stroke starts really on the inside of your lower leg, more towards the knee. The direction of strokes is towards the inside of the knee. So you're essentially just massaging up towards the inside of the knee. Hand placement slides down. Direction of strokes will almost always be up. I can't think of one situation where the direction of strokes would be down towards the foot. Even though the hand placement slides down, the direction of strokes is always up. Then, when you do the outside of your lower leg, you're going to pull over and up so the direction of strokes is still towards the inside of the knee. Here, here, very light, very gentle, and lastly here. When you get to the ankle, I like to put my hands on both sides of the ankle and I'm massaging straight upwards. If your foot is unaffected, there would be no need to go any further than this. If your foot is affected, your hand is on the top of your foot, back and up. That's the direction of strokes. And then after that, you're going to come all the way up to the armpit. And quite often, I will even go right across the lower abdomen. If your toes are affected, you can do thumb circles right in the toes. Rather than stationary hand circles, you can use your thumb and still do a thumb circle in each toe 10 times. But that pretty much would complete yourself.
Treating patients with any fluid collection anywhere in the body. So it could be something pre or post surgery, a facelift, or a tummy tuck. It could be lymphedema, where someone was actually born with it, or it could be a mum who's just had breast cancer and has had all the lymph nodes removed. So we work through a variety of different areas. So I'm just going to give you just a little taste of what lymphatic drainage is and how it works. So Monica, what I want you to do is focus your attention on the crown of your head. Gently close your eyes and draw your breath in with a big abdominal breath, drawing the breath in. Expand the diaphragm, pushing the belly up. Hold the breath and release. And again, big breath in. Hold and release. Slow the breath down, long, slow, smooth and deep. And release. 3 deep breaths are all you need to activate these abdominal nodes deep in the belly. And that allows any fluid that's collecting around the ankles and the lower legs to be drained up and be returned to the system. So, when I give a lymphatic drainage treatment, I want my patients to absolutely bliss out. So I cover their eyes just to shut out any light so they can relax totally. Within 3 minutes of me starting the specific MLD treatment, manual lymphatic drainage, the lymphatics start to work and the stomach starts to bubble. And that's fantastic. 20 minutes of a treatment allows the full body to be energized in terms of speeding up the lymphatic flow to move fluid out of the body. So that the sequence is really slow. And what we're doing is we're opening the valves and then closing them. Opening them and closing them. That's what's called manual lymphatic drainage. So we open all the nodes around the neck and the nodes around the back of the neck with exactly the same treatment. By the time I've finished doing the neck, there's no noise. Only the lymphatics start to work, and then a few minutes later they start to snore. Believe me, they start to snore. And I leave them on the bed for the rest of the treatment. From now, I then work through the body on whatever area is required.
It's a Brazilian lymphatic drainage massage.
It will make you feel lighter, less swollen. You will have a boost of energy. The massage improves skin texture and it shapes your body, so you also look cuter. And it's also very relaxing.
It's strictly technique for lymphatic drainage of head and neck. Okay, you can watch here how lymphatic drainage is performed for head and neck. Okay, you should know the Chikli technique for that, and you should always use your light pressure hands. Okay, it's a manual lymphatic drainage for head and neck. The technique is Chikli. Okay, you should know that what is the exact way to move your hands, to move the direction, in which direction the lymph nodes should be moved manually to release, okay? How to drain lymph nodes in a better direction, okay? Here you can watch that how lymphatic drainage is done for neck, okay? You can watch here the position, the direction of hands, how manually the Physiotherapist is doing. You should do the practice regarding this so you can perform effectively and efficiently. It's also good for sinus trouble patients as well. Here you can watch the lymphatic drainage of the right breast, okay? And the method here is using by the physician is the physiotherapist is using the method that name is Castley-Smith method. You can watch here the position, the way she is doing the self lymphatic drainage is a simple method, okay, for right breast, okay. You can watch that how she is releasing the points and how she is doing the drainage, okay. Every lymphatic drainage starts from 3 deep breaths, okay. After that the process, the treatment starts, okay.
Across your chest, into the top and bottom of your collarbone, just there, and then you're just sliding on your fingers.
So you're showing the exact place where to
You're sliding
release the lymph nodes, where you have to do the lymphatic drainage, okay.
to just give a little
It's the Castley-Smith method
just above the
for
collarbone.
right breast lymphatic drainage. It's a simple method, okay.
Slide and press.
You should do hands-on practice so you can be an efficient and proficient
We're using this parked car
on this
analogy.
manual lymphatic
The right
drainage,
breast
okay.
is the one that's sore or congested in this case. So the traffic light is over here.
First you have to start from proximal side, then distal, okay.
Across
You should move from proximal to distal.
So we're going to take the palm of the hand, the index finger into the armpit, and you press slightly more firmly here. Slight scooping, pushing up action into the armpit. Doing that 4 or 5 times.
She first do the neck, lymphatic drainage, then armpit, and she is doing it now
It's quite a light
from
pressure.
starting from right to
Feel the
left,
skin
okay.
being slightly cooled and wrinkled as you're sliding over, but not pressing too hard. Done 4 or 5 here. You come back and you're essentially just pushing up into the armpit again.
You should
Keep that light.
use light pressure, okay. Avoid hard pressure or deep pressure,
Your
okay.
hand into the middle of your chest.
Should be smooth and slight.
Moving all the way over and into the armpit. Repeating this 4 or 5 times. Again, into the armpit to make sure you're keeping traffic light green. And then we're here at this car. So at this point, you might find you still have enough movement here to slide over, or you might want to change hands and pull it over and then continue to push it there. Over there. And again, into the armpit, pressing spine just to go over. So you're repeating that above your nipple line. And then I'm just going to go backwards a little bit so you can see the next part of the sequence where we're moving the fluid on the same side down to the groin. So right side is the affected breast. We're moving fluid below the nipple line down here.
Now she is moving
So we start off
to the
with the groin,
distal end,
your
okay.
traffic light down here. You're doing a
to
few
release the
presses
lymph
just on
nodes,
the line of where Pat's
to release to drain the lymphatic drainage to the whole body.
Then sliding your hand
And the
down
target is the right
on
breast.
the hand's height.
And the method
Like
is Castle-Smith method.
4 or 5 here. And then again, just a slight scooping action. Moving your hand up and then sliding down towards the goal. Gently again over the skin, a little bit of pressure. So you want to use 2 hands, and you might find that it's easier just to do 1 hand. If you have somebody you'd like to recruit for this higher, once you've cleared down the side, you can think about moving from where your nipple line is or down the body here. So you're taking any fluid that's sitting here, this lower part of the
You can watch the
breast or
exact
chest
position
area,
and exact
down
placement of the hands. Okay.
and then from the inner side over. And again, use 2 hands or a brush or a sponge or something if that feels better for you. Over. And then just take it slowly down and into.
The Vader technique has the most scientific evidence proving efficacy as a standalone treatment and in combination with other therapies. The Vader technique requires extensive training and clinical practice to master. In order to be fully certified, a therapist must complete over 160 hours of specialized education, pass rigorous practical and written exams, and demonstrate precise hand movements and pressure application. This intensive certification ensures your therapist understands not just the technique, but also the complex anatomy and pathology of the lymphatic system. This is a gentle, non-invasive manual technique that has a powerful effect on the body. The intention behind manual lymphatic drainage is to augment the rhythmic contractions and stimulate the lymph nodes to improve their activity in order to reroute stagnant lymphatic fluid. It consists of 2 main parts: node pumping and fluid movement through the lymphatic capillaries. The cause of edema can be either post-operative or non-post-operative. Examples of post-operative swelling can be from a joint replacement, lymph node removal, cosmetic surgery, or any surgical operation that produces post-surgical fluid and inflammation. Non-post-operative edema can be localized or systemic inflammation. It can be due to venous insufficiency, cancer treatments, an autoimmune disease, seasonal allergies, lymphedema, or even chronic stress and high cortisol levels can result in systemic inflammation and fluid retention. The Vader technique always starts and ends with deep diaphragmatic breathing. It always moves proximal to distal to drain the affected areas, and it uses slow and rhythmic movements, gentle pressure. As the lymphatic system sits just under our skin, it is a superficial system that does not require a lot of pressure to engage. Not require any medium, so no lotions or oils, as this is typically described as more of a skin stretching technique versus a massage.
Is that we try to use the entire palm of the hand, therefore a surface as broad as we can make it that can help push those fluids. It should always be from bottom to top, thus a push towards the heart and lymphatic areas to help those fluids flow. We must try to never cause pain. Therefore, if we feel any painful sensation while working with our hands, we need to lower our pressure even more, which should be low from the start. In this case, for example, Valerio has placed his hands on top of each other, but if our patient feels discomfort, then we may need to revert to a softer technique. We have overlapped our hands, not to increase pressure, but to enlarge the area of action, because with 1 hand we guarantee a specific area. With 2, we double that area. We can apply pressure if we have a larger area to drain, allowing us to cover everything. These images are quite clear. In these cases, we use oil, though it might be somewhat excessive. In this case, using oil and cream can be a bit more helpful because we don't need that high sensitivity, unlike other treatments, but we require a lot of freedom to move. The hand should glide very smoothly and not cause irritation because we perform a series of repeated movements for about 30 minutes. Because after all, a lymphatic drainage massage is quite a lengthy application, and this aspect should not be underestimated because a drainage of a few minutes has no effect. So, take all the time necessary to do a thorough job. Therefore, using oil and cream, I'm not saying in abundance, but certainly more than other types of treatments, because it guarantees us a better result. In this case, we can properly use the force of gravity. Therefore, we lift the limb to push from bottom to top. We create an incline that will certainly help reduce recovery times. So let's say that this force of gravity helps us decrease recovery times. We can say in two ways that it facilitates the drainage massage. And let's say it speeds up the flow a bit this way, precisely due to a physical concept. Moreover, it's our hands' work that provides an additional push to this movement. We definitely shorten the time needed. This is certainly valid for every muscle group. Therefore, both the quadriceps, the calf, and the flexor muscles. Always use light movements. Try to cover as much surface as you can. Drain towards the heart and try to take advantage of the slope by elevating a limb or by using wedges, pillows, or our body, therefore supporting them directly on us. By using all these techniques, these little tricks to achieve a satisfactory result. So, does lymphatic drainage massage in this area have special characteristics? Let's say the technique is the same. In the calf, we may need a few more little tricks. Why? The path this fluid must take is a bit longer, because from the calf, it needs to rise as the most distal part of our body in two ways, and getting all these fluids to flow can be somewhat more challenging. It can get a bit more stagnant. We can say the technique remains the same. In the calf, we might need some extra little tricks, because the route this fluid takes is somewhat more long. Because from the calf, it must ascend as the most distal part of our body in two ways, and getting all these fluids to flow can be a bit more challenging for sure. However, by always using this technique and ensuring adequate time to exploit it, as we will see later in the video. And also using an incline, a slope that allows us to give an additional boost will help us. Now, as you can see, there is a partial incline. We can always drain because we have a current that flows through the entire calf to the popliteal fossa. If we have a cushion here, something to place under the ankle, we use it. Otherwise, we rest it on our leg, just as you see. In two ways, we can ensure this incline if we want to be more incisive. We take it straight up, as we will see later in the video. In this way, we can also encircle the calf with both hands like a ring and apply an even more aggressive push. What we are seeing can be done in a slightly more advanced state when the pain is somewhat reduced, and we can embrace with both hands and slide them. In general, doing less than half an hour is not advisable. Look, this is the technique Valerio explained earlier. He has practically overlapped his hands. He has bent the knee at 90 degrees and is performing this drainage this way. Now you are alternating them. Yes, then you can embrace with both hands and do work on a larger surface like we did with the quadriceps. Only that the calf, being a smaller muscle, sometimes too much wrapping can cause painful symptoms. We should not create pain in this case. This is important in this technique. We should not generate a painful symptom as it might be normal. For example, in the case of a decontracting massage. Let's say the application is indifferent, in the sense that we use the same technique with the same intensity, with the same methodology. The only real variable we have for the flexor muscles, unlike the others, is that in this position we cannot guarantee a vertical alignment. It's always about stroking. So stroking always with slow movements, light movements that cover the full area and always go from bottom to top. This is, we might say, the key approach in a draining massage. Now we are seeing a gentle stroke over the tibial malleolus. While in muscle work, you do cyclical movements with a large surface, always from bottom to top. Here we must conform to the joint's design on both sides, as you see on both malleoli. Since it is a small joint, we can do this. We can apply a general pressure, surrounding the whole ankle and always draining from bottom to top, while working very, very long on both malleoli. Is the pressure higher compared to other areas? No. It might feel like more pressure due to the very thin skin layer. Thus, it can give that impression. In reality, the pressure is the same as what we have used previously. A soft touch, something very delicate. We also attempt to use, in this case, the force of gravity, so we try to use it in our favor, not against us, as it would unfortunately occur with someone standing. In this way, we tilt the leg and work more meticulously compared to a large muscle group. We need to work on the whole joint, including both the inner and outer sections. And can this type of drainage also be useful in cases of distortion, that is, indirect trauma? Absolutely yes. The concept is the same. In any case, there is fluid that has infiltrated the joint, which may be distorting in nature. Also in this case, always below the pain threshold. We must eliminate all that excess extravasation that has been generated, and we do it bilaterally. Okay, when we say bilaterally, do we treat both the inner and outer parts of the same ankle? Yes, both sides of the ankle. Here we see a different setup because Valerio is showing us essentially the same techniques from this position that promotes drainage. When we utilize perpendicularity, meaning we position the limb vertically, we can surely drive this fluid out more quickly and efficiently. Thus, we encase the entire joint with both hands and always do this drainage very gently. If we have a lot of fluid, that is, if we notice excessive presence, we can extend the drainage all the way to the calf, attempting to carry it as far as we can. Thus, we do not stop a few centimeters from the malleoli, but continue to the popliteal area, which is also relevant for massage that is more centered on the calf. This same concept can be applied to the ankle, taking advantage of the entire calf. Direct traumas can occur in nearly every part of the body, so the principles we've shared, the techniques, but most importantly the reasoning, can be applied in every area. Very well, this was our...
It's manual lymphatic drainage for approximity. Okay. It's a step by step. You should know the exact steps that how you have to release the lymph nodes, how you have to drain the lymphatic drainage manually. Okay. From neck back, from the back of the neck, how you should drain the lymph. Okay. Lymphatic drainage of the side of the chest. You should know the exact hand placement, okay? How you should drain the lymph nodes from of the upper area of the chest. You should use your palm, okay? And the pressure should be gentle, light and smooth. Avoid hard pressure and deep, okay? Lymphatic drainage of this side, okay? You should do it step 5 to 10 times, okay? Lymphatic drainage of the sternum. Lymphatic drainage of the shoulder. We should always start from proximal to distal, okay? To clear circles. You should know the exact movement, exact position of the hand, okay? Fingers, thumb, okay? Lymphatic drainage of the forearm area, okay? You can look at here that she starts, first you start from shoulder and then biceps and then elbow to forearm, okay? She is moving from proximal to distal area, okay? Now she is moving to the palm, back side of the palm, okay? Now she is doing lymphatic drainage of fingers, okay? Starting from thumb, okay? You should know the exact sequence. Now palm area, okay? Now lymphatic drainage of the back area, upper back, lower back. You should stretch the skin and release. Look at the movement. Lymphatic drainage is best for releasing swelling, okay? It's a good technique.